Hi.
Hi.
This is Leslie. She's a patient of ours. Leslie's had some really great success. She had trauma and lost consciousness, and then had some issues of brain function, really. And so we call that a traumatic brain injury or mild traumatic brain injury. Mild meaning that she didn't have a fracture of the skull. But so just going to turn it over to you. He's going to focus on you. Tell us what life was like, and then what life has been like since you have had treatment with us.
When I came here, I was just a mess. I thought I was going crazy. I couldn't remember anything. I was confused all the time. You couldn't give me more than one instruction at a time. Like, you couldn't say, go to the back of the room, get a glass of water, put the cup on the table, and then come back and sit down. I would have gone, whoa, 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 and I probably would start crying because I couldn't, my brain just couldn't handle the information. I really kind of thought my life was over with. I mean, I thought I'm mental. I have lost my mind. I can't function. And prior to that, I was strong and vibrant and athletic, and all of a sudden, all those things were gone, and I was just a shadow of myself, and I was just mortified. I was really reluctant to come. I was referred by another doctor who's been working with my spine because I couldn't shake the migraines, and my eyes hurt so bad and my ears ached. It was horrible. I put on he gave me a pair of red sunglasses, and I put them on. My stress level went, literally 80% of it was gone. And that helped me so much. I had seen another neurologist. This is a great example. This was right after my accident, the first accident. And I sat on the table. I was woozy. I couldn't see right. My eyes hurt so much from that light. Would have crippled me a few months ago. And he hit me on the knees to check my reflexes. And he checked to see the dilation of my pupils. And then he prescribed me 2 months worth of Percocet, which I proceeded to take in a month because of the pain in my neck and my back that wasn't being addressed. Or was being addressed not quite yet in the right way. So then I went back a month later. He did the same thing, and he gave me more drugs. So I was effectively becoming a druggie. Not a good thing. I was on a lot of Percocets, and I was on Valium to sleep because I was very uncomfortable. My body was uncomfortable, but I could take the Valium, conk out, literally, and stay in the same position. I don't think that's good. So that's how I was treated in mainstream. I was treated as a person with something wrong with her. You're sick, you're over there, I'm going to tell you what to do, you're going to take all these medicines. It's going to make you better. And it's not true. It made me very sick, and I started to lose myself, and I got scared. So coming here, I felt hope for the first time when I sat in that room with you, Dr. Winters and Dr. Rogers. And even though I was a hot mess, I was a mess, but I felt hope, and that was real. Because there was hope, and I saw myself getting better, and the way that you and Doc are, the way that you do the therapy, and me knowing every time I left, there was a little something more. I'd wake up the next day and I could feel it. Even the tiniest shift because I was so broken. A really big turning point for me, Dr. Winters, was I was standing on the rocker board, and I was all over the place. And it was miserable, it was getting miserable. So you came up to me, you put your hands on my shoulders, and you said, relax, I've got you, you're not gonna fall. And you were right there, you looked me right in the eyes, and you didn't say, hold on, relax, you're not gonna fall, don't worry about it. You said, hold on, relax, you're not gonna fall.